everyone over 6 months should get a flu shot. There are some people for whom it's a little more important. I would say the vaccine might have additional value, kind of a bonus value. A few groups of people that I would say are high priority. One is pregnant patients. When you're pregnant, you get flu worse. And when you get the vaccine while you're pregnant, it protects you. It also protects the baby after birth. So that's a high priority there. Children get the flu the first, and they get it the worst. And so if you have children, then getting them into the doctor to get their flu shots will protect the whole family and keep them in school and prevent them from having to take time off. Seniors who get flu tend to have other medical conditions that make it more severe, so they're recommending to get the flu shot. And by the way, there's a special flu vaccine for seniors called high dose. So ask for that if they have it, and that will benefit you. And then any other adults with medical risk factors, if you have heart disease or lung disease or kidney disease or any other disease that is a health issue, then you should get your flu shot right away. All vaccines stimulate your immune system. That's what they're for. And when you do that, your immune system responds, and you can feel that. You can feel, maybe a little bit tired, maybe kind of a fullness in your head, not really a headache, but your body just feels different. Maybe a few other mild illnesses that indicate that you have kind of an inflammatory reaction going on in your body. It's not severe, and it goes away quickly. I had my flu shot last week, and I was a little bit tired the next day, but that's all. I had no other symptoms, and a cup of coffee fixed that. So the side effects of flu vaccine are very mild, and it should not be a reason why you shouldn't get it. The main thing initially is fever. You normally feel tired and headachy when you have a fever, but all of those symptoms are symptoms of infection. You generally will have some trouble breathing, or you won't be able to catch your breath as easily on exertion, because influenza is a respiratory infection and it's damaging your lungs, and your lungs can't move oxygen when they're infected with flu. So if you exert yourself, you'll be short of breath. So maybe some cough, maybe a bit of a sore throat, maybe a runny nose, but it's mainly the fever and the shortness of breath that's the problem. If the fever is high and persistent, and you're having trouble breathing, then it certainly is time to call your doctor, and your doctor might assess you and decide that you're a candidate for one of the anti-influenza drugs that we have available. We do have some indications of what's going on with flu, because flu is a worldwide disease, and the flu season in Australia, for instance, the southern hemisphere, is just ending. And it was a normal flu year for them, and the experts are predicting that it's probably going to be a normal flu year for us. So similar to last year, there's no signals that it's going to be a particularly high or low year, so they're predicting it will be about the same as last year.